I've performed over 10,000 dental implant surgeries since 1988, and almost without exception, patients are amazed at how fast and easy the procedure is. Typically, they'll say it was one of the easiest dental procedures they've ever had. We numb the gum with a local anesthetic, and the gum and the bone are much easier to numb than a tooth. When I place a dental implant, the surgery for a single tooth implant typically takes 8 to 10 minutes. After we're done, most patients only take a single Tylenol or Motrin, and they feel fine the next day with minimal swelling, minimal discomfort. Patients typically ask how many dental implants they need. When we're replacing one tooth, we need one dental implant. When we're replacing more than one tooth, typically for 2 or 3 teeth, we need 2 dental implants. The 2 dental implants are spaced apart, and then a 3-tooth bridge can be placed on the implants. As opposed to a 3-tooth bridge placed on natural teeth, this isn't going to decay. When we're replacing a whole arch of teeth, typically we can do that with 2 or 3 implants per side. So they're so strong, if we can space them properly, 2 or 3 implants per side, we can replace a whole arch of teeth. Many patients think that dental implants are new technology. Nothing could be further from the truth. The human research on dental implants began in the mid-1960s, and these patients were followed for over 20 years before Professor Brannemark presented his research to North America in 1984. I started placing dental implants in 1988, really at their infancy in the United States, and I've placed over 10,000 dental implants since then. Most patients have heard about dental implants now, and almost everyone has a friend who's had some dental implants. And I would say by the mid-90s to the late 90s is when it really became the accepted method of tooth replacement among the general dental population. Many times patients can be concerned about the cost of dental implants, and there are really 2 things to consider with respect to cost. When you're replacing a single tooth, a dental implant restoration can be perhaps 10 or 15% more costly than a 3-tooth bridge. Although a dental implant may be more costly initially, the value is much greater over the long term. Even forgetting about the cost of having to redo the dental bridge, the most valuable commodity most people have is their time. Who wants to spend their time having something redone if it doesn't need to be redone? Who wants to get Novocaine again, go to the dentist again, sit in a chair, have all that be redone again? Most people appreciate that it's better to spend a little more initially and then have a restoration which is exceedingly durable and has an excellent chance of lasting their entire life.